Is there a possibility that that kind of thing happens?
First of all, our incubators are fitted with, are well fitted that they cannot overheat, and the maximum it can go is 38 degrees centigrade. So for someone to say an incubator, the temperatures were turned up, it is actually very wrong. Having worked with infants for such a long time, it is an untrue statement, and we want to refute it as a county.
Waziri, from insider information, and this is reliable information, we know that, and you've also accepted as a teaching hospital, you have interns working in the wards. Perhaps you may want to tell us how many qualified nurses and doctors do we have in the facility, and how are they distributed?
We have, the nurse who can give us the correct numbers of the doctors at the moment, so we have enough. And distribution is not usually very fixed, because as need arises in other departments, we are able to deploy. The nurses are under the chief nurse of the facility, while the doctors are under one of the consultants in the facility. So they can work in rotational basis according to the needs of those facilities. But here, we've had our staff, long-serving staff, who have been working with our neonates in the maternity unit, and they have had several years of experience. We have trained our staff on the issues of neonates. We have done ETAT, which is training on infants on how to take care of them and neonates. We've done, through support of many partners, we've trained on how to take care of infants from the time they are born. So our staff are really qualified, and they cannot do such that we have seen in the media. That is really a slanderous statement for people of the quality of training that they have.
We would be interested in finding out how many we have, the qualified ones, and how they're distributed, because that is inside information. And then perhaps the last question is, do we have the records of new births as from Thursday to yesterday? Do we have the records? Are they available? And if you've said no infant has died in the incubators, if at all there's any infant who's died, what is the cause of death?
Records in hospitals are one of the common things that we do. There's nothing that we do which we don't record. We record births, we record deaths, we record patients that we see, and eventually they will land in KHIS, which is the records kept by the government. So there's nothing which we do which is not recorded. So I can confirm that everything that we do is recorded, books, and also in the in soft copies.
Can it be made available to us?
I cannot give out such information because of the issues of patient confidentiality and the issues of management of data in the national government. It is restricted unless otherwise we cannot be able to give out.
With all due respect, we're only talking about the numbers, not the names of the children. The numbers of this is the number of children who died or who were born, and this is the number of children who died, and this is the cause of death, not their names.
It is not allowed for us to just give out information of the hospital anyhowly. I don't know why you are not believing what I'm telling you. That we have records, we have not had such deaths, and we have our consultant even. She's just behind me, our pediatrician, who runs the unit, and we can confirm that our patients are well taken care of.
Forgive the skepticism that we do have about the same. But is there any death so far? Because we have reports that there are 2 actually. Probably not the 7 that is already there. Is there any death of any infant within the same period? Probably in 1 week.
Let me give to the facility, the med soup and the pediatrician. Maybe they can say something.
Okay. I'll ask you to ask afresh the question.
Yes, in her statement, Waziri said that there is no death that happened in the incubator. So we are asking, have we had death in the period between Thursday and yesterday? Have we had infant deaths? What were the cause of
Let me correct you. Waziri said there's no death due to negligence. That's what she said.
And how there's no death now is there death, and what is the cause?
Okay. Let me I'm the in charge of the facility, so I'm giving the factual information. So our facility is a referral facility. There are people who come here, the mothers who deliver here, and then there are other referrals done from peripheral facilities. From the department, from the consultant who treats children and newborns, as part of the records which you were asking, there were referrals from outside. There was even a baby who had been abandoned outside in the street, who was brought here, who was in severe condition. That's one of the cases who we lost. So what our CC said is not out of negligence. In the month of January, we lost babies. In the month of February, we lost babies. Why now? Why now? You know, we're asking ourselves why. Because these are hospital. There are people who will get well. It can go either way. Some people, if they are very bad, you can lose a life. It's a fact. So it's a fact we lost some lives, but it's not out of the ordinary. It's not as portrayed in social media. I don't know what I don't want to quote because it's below us. Those are just rumors. So I think I want to be very clear. We had some referrals from outside. They were in bad conditions, and unfortunately we lost them.
How many? How many are you talking about? At least
from the referrals.
The facility should be having records of
now.
the past 1 month.
What we did because the newborn, the new unit here, as you see, is a department in its own. We have asked them to give us, because they usually do monthly reports. Today is on 10th, so we have asked them to prepare reports. But as far as we are concerned, there is nothing out of the ordinary which has happened. So we want to dispel any rumors. There's no healthcare worker who wakes up in the morning to come and kill somebody. It has never happened. So let us be very honest about each other, and let's be factual. All we do is try to save life. Unfortunately, if there's a life which is lost, it's on the last end. Everything has been done, and it's for. So we dispel all the rumors. Kindly.
At the moment, we have some infants in the nurseries.
Of course, we have. Somebody was asking. On average, we have over around 15 on average deliveries. Both done cesarean, natural births, even so on a daily basis. So in a month it's around 300 deliveries as a facility. So it's something which is there daily and it's in the records. Somebody was asking about. I think I want to answer that. So on average we have like 15 deliveries per day. So out of 15, for those who don't work in hospital, I know you don't work in hospital. There are some difficult births. Labda mtoto hajapumua vizuri, amechelewa, amechoka, such kind of things. So you can lose such a life. So I urge you, let us be professional in the way we report our things. Things of posting, and I think Wazir and the Chief said, our offices are very open. You can come anytime for facts. Don't rely on the ESAs. And we are open. These are public facility and it's open door policy. Anyone can come and ask for anything. Even clients who are aggrieved can come to seek redress, and we are there to assist them. That's why we're here.
Doctor, we appreciate and we really appreciate how you're bringing it out.
Yes.
And yes, like you have said, open door, and that is basically what you're trying to find out here.
Yeah.
And we can only report facts if you avail facts to us. In terms of you're saying statistics of 300 a month, we are asking how many deaths have we had? Waziri is saying the records cannot be found, cannot be made available.
No, they are there, but you cannot. There are policies guiding those records, how it's handled. But what I'm saying, the departments usually have monthly meetings to review the records. They will say now in the month of maybe February, how many deaths did you have? How many deliveries did you have? The deaths, what caused them? Is it something which is preventable? Was there a mistake? So audits, such kind of things. So we're on 10th. I'm sure for the month of March.
Dr. Allow me to interrupt you. This was a special kind of phenomenon that happened.
According to the rumors.
I don't want to assume
according to the rumors.
Yes.
Not on the ground.
And of course, Dr. Before you came here, we expect you to streamline or make clarification on what's happening. We are so particular, if you could realize what my colleagues are asking. We're so particular. We want to know, is there any death within this past week? So if you say we were waiting for the record for the end month, you're not really helping us out.
Okay, let me respond.
Yeah.
Let's agree first. We'll not base our conversation on rumors on social media. Let's agree first. So I've said, We had even a child who was referred here, who was found abandoned, and we lost the child. I think it was on Sunday.
Yes.
So that's one of the cases which we lost.
So can we comfortably say it is one, and it was probably a police case or something like that? Can we say it is one?
You can say that. You can say that. But the official records and everything comes from the department. You know the department. You're asking about staff, eh? Somebody asked about staff.
I did.
In the unit, we have a consultant. I don't know if you know what a consultant means. We have a doctor, consultant. We have some junior doctors, medical officers who work there. We have nurses who are trained to work at the unit. We have clinical officers. We have other staff, support staff, record staff. There is a whole team working there. And as you see, we have a new unit. I'm sure in the region, you'll not find like this. Go to Iten, go to West Pokot. I mean, let us be fair. We have one of the best facilities here in the region. So, instead of people reporting good news, they just wait for one day. Why are you not reporting the good things we're doing all over? Why are we waiting for one day to report? Last week, we were doing good things. Why didn't we report? Come to see our surgeries which we do here and report somebody who was sick na amepona. Personally, I'm an eye doctor. We restore sight. Mtu mwenye aoni tuna operate na kesho anaona. Why don't you report? Come and report those things.
Please invite us and we will report that. The last question. One question. The CEO, the chief officer.
Okay. Okay, my question is that we have an internal memo that we got from El Maravin that the hospital there is no admission for male and female wards. What is the position?
The position is that the female and male wards of the Maravin sub-county hospitals are open. I was there yesterday. All of yesterday, I held a meeting with the top management, consultants, and the doctors. As we speak, as we were holding the meeting, there was an operation taking place in the theater, and ward rounds were done. The female and male wards are open. That's what I mean.
What of the internal memo that said that which was coming from the doctor, their concerns that there were few doctors?
That memo was ill-timed. It was not proper because the person who purportedly released that memo did not get the facts right. And as we speak right now, I want to confirm that we have 6 consultants as we speak, and we have 4 MOs, we have 13 clinical specialists, and around 16 CEOs, general CEOs. So services at El Maravin sub-county hospital are in full swing. There is no patient who has been turned away. In fact, I went yesterday and I supervised and made sure that every patient that came to that facility was attended to. Yeah.
What of the changes that took place? What of the changes that took place?
Sorry?
What of the changes that took place?
What about the changes?
Yes, because we understand Dr. Marach had to be taken there, and of course the person who was there was demoted.
There are changes everywhere. Even in BCRH, there are changes which are taking place and you are not aware. There are even some which are taking place in Marigat right now. There are some even in our headquarters office which are taking place. Why is it that these changes in El Maravin is a concern? This is administrative. We actually change because of issues of capacity. We see who is supposed to go where to enforce and strengthen services to our people. So changes are positive, but it's meant for the good of the people.
From your own document, the county's strategic plan 2018-2022, you indicated clearly that human resource bottleneck is one of the issues facing the Department of Health in Baringo County. And from what happened in El Maravin, it is clear that your plan or the strategic plan 2018-2022 came out from what happened in El Maravin. Is it happening in in Eldama Ravine alone or also in other health facilities.
In short, what is the staff?
Yes,
what is the staff shortfall
number?
that we are having?
Yes.
We're talking about Eldama Ravine, and also, if you allow, for this particular facility, what is the staff shortfall for Baringo County?
First of all, let me comment and say that staff issues, HR issues, as we speak right now, even new press, you still need one additional person to support you. Isn't it so? We will always require additional persons to serve us in this facility. But we have optimum number of staff to attend to every section of the hospital as we speak. But we want to increase the number of and you know, make services more effective by probably making additional staff. That means that does not mean that there is no. I told you I was in Eldama Ravine yesterday, and services are full swing. There is no complaints. The doctors are there, our CEOs are there, and they work in shifts because of the number of wards that are there. We have our consultants who come on call to attend to patients on issues of emergency. So I can report to you that yes, we may have a shortfall of staff, but by the end of July, we'll be able to recruit more and fill the spaces and vacancies that we think we may need additional staff.
How many doctors do you have in this region?
We have 72 doctors. Yes.
So, just to get it on record, can you possibly, we are still insisting on it, get the records of course now you've said the other one, it has wait for a month. Can you get the records of qualified nurses and doctors, the numbers, not even the names, the numbers at this particular facility and how they're distributed, perhaps after this press conference?
After this?
Just to get it on record, I mean your confirmation on record.
That's fine.
All right, thank you, sir. Thank you so much. Asante sana.